Welcome to the Medicare More program. My name is Ed Roth. I'm with the Central Mass Shine program. Today we have a couple of very good guests. We have Kathy Devine from the Prescription Advantage program, and we've heard from Kathy before. I'd also like to welcome Cindy. Cindy is the state director of the Massachusetts Shine program, and she's joined us as well. So we're going to talk a little bit about Prescription Advantage and maybe a little bit about the state Shine program and the whole concept of Shine and how it works throughout the state. Kathy, Prescription Advantage.
Yeah, should we just get started?
Let's get started. Jump right in.
All right. And I think both you and Cindy will agree that this has often been accused of being the best kept secret in Massachusetts. This is what we refer to as a state-sponsored pharmacy assistance program, and it's for our seniors in Massachusetts, and it's to help them pay for their prescription drugs. One thing that I do want to point out is that if we do have a senior that has a Medicare prescription drug plan, okay, this does not replace what they currently have, right? They keep their Medicare prescription drug plan. What Prescription Advantage is going to do is really give added benefits. So it adds benefits to that Medicare Part D plan.
That's right, Kathy. And we get calls sometimes, and unfortunately our seniors do get confused because they think Prescription Advantage is their drug plan. And unfortunately we explain to them, no, it really isn't. You have to get a Part D plan, and what happens is that I believe the Prescription Advantage program supplements the Part D plan and helps
That's
folks
right.
with their co-payments at certain levels. Not all levels, but certain levels.
That's right. That's right. And I know that Cindy's office gets phone calls all the time, as does yours and all of the other Shine programs across the state, particularly at a time when people reach that coverage gap in their Medicare Part D. Okay, I think a lot of people have probably heard the term the donut hole, and even though they've heard it and they know it's not a place they want to be,
That's for sure.
but oftentimes they don't know, how did I even get to this donut hole? How does this even happen? So I'd like to talk a little bit about that first, because to be able to understand how Prescription Advantage will work with that Medicare Part D plan. So the donut hole, what
Absolutely.
happens? Okay. The donut hole, people will reach that coverage gap when the total retail cost of their prescription drugs hits a certain number. Okay, so this year that magic number is $3,700. Okay, now keep in mind that's the retail cost of the drug, and this is what often confuses people, because they'll say, you know, oh, well, I would never reach the donut hole because I would never spend $3,700 on my prescriptions.
True.
You know, and I know that you hear that, and it's not a matter of that individual spending $3,700. It's the total drug cost. So somebody might have a prescription that the cost of the prescription is $40. They may have paid $10 in their copay. But behind the scenes, what's happening is Medicare is keeping track of both what the individual is paying out of their pocket and what their Medicare Part D plan is paying. So if it's a $50 drug and the individual paid $10, well, the insurance paid $40, so Medicare says, well, that's $50 right there. So with every prescription, and this starts January 1st, every prescription that the person gets filled, Medicare is keeping track of that total cost. So how quickly do people reach the donut hole? You know,
You've seen some cases where it's happened in
in
January.
January,
even. Yeah.
exactly.
Yeah.
You know, this is something
right.
that we talk about all the time. Cindy and I and the rest of the Shine directors, I know, Ed, you and I have had conversations about the rising cost of prescription drugs. that
And
even if-
I think to interject, I
Yeah.
think what people don't understand is exactly how that donut hole is reached. They may
Right.
see, some of them may pay a zero co-payment, but the drug may cost something.
Right.
Some folks may pay
Yes.
a $10, you say a $10,
Or even a percentage these
$20
days.
co-payment.
Right.
Which is very
And
high.
that drug may cost, the retail price of that drug may be $200 or $300.
Exactly. You know what, I think you raised a good point,
Yeah.
Cindy, is that sometimes it's not a flat rate copay, but it's that percentage.
Right.
And it's a percentage of what?
Of your tier 4, which used to
Yeah.
be a tier 3, but now it's more expensive.
Exactly.
You know, all the rates are going up a lot.
Yeah, the changes. So I know that people do get from their insurance company, their Part D plan, they do get an explanation of benefits where it will indicate how close they are to reaching that coverage gap, but they're not the easiest things to read. And also, people don't really pay attention to the retail cost of their prescription drugs. I had to point this out to my husband, who complained about a $30 copay that he had. And I said, well, how much was the prescription? And he said, well, I don't know. And I looked at the receipt, and I said, you know, that prescription was $359. I said, you should be
30 sounds pretty good.
You should be very happy that you only paid $30. But what happens, you know, okay, we talk about, you know, you're going to reach the donut hole. So let's say the total cost of your prescriptions does reach that $3,700. Okay, so now you know I have just reached the point where I am now in that coverage gap. Okay, this is where people will see their prescription, their out-of-pocket costs go up. So forget what you were paying for copays, because once you're in that coverage gap, you would now be responsible for, if it's a brand name drug, for a 30-day supply, you'd be responsible for 40% of the cost of the drug. And if it's a generic drug, it's 51%. Now, and we all know, just generic doesn't always mean inexpensive.
No.
I mean, we've
Not
seen
anymore,
No,
right?
no, we've seen generic drugs where a 30-day supply could be a couple $100s. Can you imagine if you had to spend 51%? And that 30%, I'm sorry, 40% for a brand name drug, which of course I had to point out to my husband again.
Good thing he's there.
I know, that said, you know, if you were to reach the coverage gap and had to pay 40% of that, that would now be, I think it was somewhere about $143. So it's a huge amount of money, but for many people in Massachusetts, this is where Prescription Advantage can help. They reach the coverage gap, and with Prescription Advantage, you know, this is something that can help lower those costs when they are in the coverage gap. So as a program, being a state-sponsored program, which means that this is something that's funded through the state, it's funded through tax revenue. Like many other programs that are both federally and state-sponsored, it has income guidelines. Okay? So to qualify for Prescription Advantage, we do have two eligibility checks. One is that you are a resident of Massachusetts, and the other is that you do meet the income guidelines. So for a person who is age 65 and over, and they have Medicare, in order to have coverage in the donut hole, and I'm going to give you those amounts for the coverage in the donut hole, and I'm sorry I have to read them because I don't have them memorized yet. These actually they're just changing
Hot off
as
the
of
press.
April 1st. So for a single person, as long as their gross annual income does not exceed $36,180, or for a married couple, if gross annual income does not exceed $48,720, with Prescription Advantage, you would have coverage in the donut hole, and at those income guidelines, there's no charge for Prescription Advantage.
Wow.
It's free.
Wow. They are astonishing.
Why not do it?
I know,
You
That's right.
exactly.
What would be
And they're
reason not to do
astonishing income levels as well. I mean, you don't
Right.
see a lot of public programs that have
No.
income levels as liberal as that. So
Yeah.
And plus, they're not looking at what you have in the bank for assets.
they don't
That's a
look at
good
assets
point.
either, do
Yeah.
they?
They don't.
So that's
We're
a
not
real
looking
benefit.
at assets. And, you know, oftentimes people will disqualify themselves. They'll say,
Right.
oh, I would never qualify for Prescription Advantage because I own my home. Okay, we don't care.
Doesn't matter.
That doesn't matter. Or that, you know, I have a bank account. We're not looking at that.
Right.
We are looking at gross annual income. So that could mean Social Security income. It could be pension income. If somebody might still be working, all right, it could be wages.
Sure.
But as long as it doesn't exceed those amounts that I gave you, again, I'm just going to repeat them because I think this is important because a lot
Very
of
important.
people would qualify. So for a single person, it's $36,180. For a married couple, it's $48,720. As long as your income does not exceed that, Prescription Advantage, again, will provide you with coverage in the donut hole, and there's no charge. So let's talk a little bit about how it works. Okay, so we said this is a supplement to your Medicare Part D. As a Prescription Advantage member, we're going to issue you an ID card. Okay, has your ID number on it. You make sure your pharmacy knows that you have Prescription
Right,
Advantage.
right.
So let's say we have somebody with that $359 prescription, and they're at the pharmacy, standing there with the $30 in their hand because that's what they're expecting to pay for their copay. And the pharmacy bills that $359 to the Part D plan, and the Part D plan responds back to the pharmacy and says, charge the customer $143. Pretty shocking.
I'll say.
But that's when the customer would say, wait a minute, I have Prescription Advantage. And the pharmacy's going to bill that $143 to Prescription Advantage. Now, when Prescription Advantage receives that bill from the pharmacy, we're going to look to say, okay, this is our member who is in this particular membership category, and they're now in the donut hole, and we could say either charge the customer $18 or charge the
Instead
customer
of 30.
yeah.
That's
Or it
great.
could be 30, it could be one or the
Depending,
other, you
right.
know, because
So the most you're going to pay for a brand name prescription, if you have Prescription Advantage,
Yeah.
the most you're going to pay is $30.
That's correct.
And it can be as less as $18.
That's
for
right.
For a
30 day?
for a $600 prescription.
Exactly.
Amazing.
Exactly.
Amazing.
You know, we talk a lot about, you know, again, going back to that high cost of prescriptions.
Sure.
But think of things like an inhaler.
Oh,
What's the highest price inhaler you've ever seen?
astonishing!
Yeah.
They're in the hundreds of dollars.
Oh, yeah,
You
easily.
can't do without it.
No.
you know.
It's
Exactly.
amazing, and you see that. I had a lady yesterday. Fortunately, the woman was on LIS. She did have some help, but she was taking 3 inhalers.
Right.
Wow.
Without help, that Part D
wipe her
plan would be astronomical, being $1,000 a month, easy.
I have
Not
to
a
say,
problem.
the least expensive inhaler I've seen was just under $300. The most expensive was over $800. I don't know what they're
Incredible.
putting in these to make them.
Must be
but,
gold.
Oh,
you know,
very
and the
good
other,
example.
the other thing too is insulin. Insulin, the
Yeah,
price
that's
of
jumped a
insulin
lot.
has
Yeah.
skyrocketed. You know, we've read articles about it, that how it's increased over the last couple of years. And I'm willing to bet that anybody who is using insulin is at risk of hitting the donut hole. It's that expensive.
It is. It certainly
Add
is.
that along with maybe a couple of other prescriptions. So again, keep in mind, every time you get that prescription filled, it's the retail cost of the drug. It's the combination of what you're paying out of your pocket as your copay and what your insurance is paying. Add the two together, and that's what's being accumulated to reach that $3,700.
And Kathy, we mentioned a situation where in a donor hole you'd pay 40% if you didn't have Prescription Advantage.
That's right.
Okay. Now, as we speak here today, we're here in mid-March, and there's a lot of flux with healthcare. I don't know what the status of the donut hole will be
That's a
with
mystery.
the new.
Right.
There's
That's right.
mystery.
Yeah.
I mean, unfortunately or unfortunately, the ACA allowed the donut hole to decrease. When, as I recall, when Part D was first put into effect back in 2006, the donut hole, if you hit the donut hole, you paid 100% of
That's
the
right.
retail cost of the drug. Goodness gracious, we don't want to go, God forbid we go back to those bad old days.
I know.
So PA is invaluable.
It's a good protection.
You know
For
what?
protection.
It is, and this is why we tell people all the time. Even if you said to me, "I've never reached the donut hole," my response would be, "If it's not going to cost you anything, apply for it."
You never know.
Because you never know. You could be prescribed a new prescription tomorrow that could have a retail price of hundreds of dollars.
Right.
And you just didn't expect it, and that could push you into that donut hole, at some point during the year. And there's one other thing I also wanted to talk about too, and I know that this is near and dear to your heart, Ed, because you use it all the time. That special enrollment period.
Oh, it's a lifesaver.
Yeah, it is. Just for being a Prescription Advantage member, okay? Even if you never reached the donut hole, but because you are a member, you are entitled to one additional time a year that you can change your Medicare Part D plan, and that would be outside of Medicare's open enrollment period. So Medicare has their open enrollment period every fall. That's the time that,
right.
People should be looking at their plans and saying, okay, this is what I have this year, but is it going to work for me next year? And so often people don't check because they just say, hey, I have this particular plan, it worked great, I'm just going to keep it. And then January comes along and they realize, oh, my plan that I loved so much last year, the premium increased, the co-pays went up.
It dropped my meds,
Exactly.
whatever.
Now they don't cover two of
Yeah.
my medications. Now, ordinarily, somebody would be stuck with that plan
That's right.
for the entire year. But as a Prescription Advantage member, you can just pick up the phone, call the Shine office and say, you know what, my plan is just not working for me, and is there something better? I have Prescription Advantage, I have that one time that I can change.
Or we would sign you up for Prescription Advantage, wouldn't we?
Exactly. And I know this is what you do all the time, because the first question is, all right, we need to be able to change a plan. How can we do this? Do
right.
you have Prescription Advantage? Let's get you on it. And then we're able to move on to finding a better Medicare plan for you.
And I know, Carrie talked, we've talked about Prescription Advantage any number of times on the Medicare and More program. I think you've been on 3 times, but it's so invaluable. It really is. That special enrollment, if you're going through the year, you're fine with your drug plan, everything's nice. You go to the doctor, your doctor says, oh, gee whiz, it's not working. We got to give you a new med. Well, if you get that new med, it might not be covered by your current drug plan.
That's right.
You know, the other thing that I'm
Yeah.
thinking too is people are Medicare Advantage plans with a Part D, and the doctor might drop the plan altogether and no longer accept that insurance.
That's a good point,
That
Cindy.
gives you another opportunity to
Yeah.
maybe make a change to a different
Right,
plan.
right. The special enrollment works for any plan, whether it be a Part D standalone drug plan or a Medicare Advantage plan like a Tufts or a Fallon Senior plan.
That's right.
That might go bad on you. Maybe your doctor isn't taking the plan anymore, or something happens, your doctor passes away and retires, and you don't like what's going on with that particular Medicare Advantage plan. This special enrollment will give you an opportunity to enroll in something else,
That's
to enroll in a completely different type of Medicare plan if you want to.
Yeah.
Invaluable.
It really is.
At no cost, my friends,
Yeah.
for
And
most people.
the best thing, because I did mention that Medicare has that little window of time, their open enrollment period that they have every year. Prescription Advantage has a wide open,
Year-round.
year-round open enrollment. You know, you can join in January, February, March, it doesn't matter, you can join at any time. We're very busy this time of year because people are realizing, I should have checked my drug plan to make sure.
It's true.
And then, as the year goes on, we're going to be busy as well because people are going to be reaching the coverage
That's
gap.
right.
So, you know, I like to say, do it now. Don't wait until you're in the donut hole.
And how do you
And
sign up?
I think we can all recall, I mean, Cindy was a region director back when I first started.
Mm-hmm.
And certainly you can recall the bad old days when Prescription Advantage did not have continuous open enrollment.
That's right.
We
And-
had a little window.
You had a
That's
little
right.
window from time to time.
Yeah.
And if you didn't fall within that window,
Mm-hmm.
you had to wait to pick up a drug plan. And that was
a hardship.
terrible for folks.
Yeah.
It hurt a lot of people.
It really, you know, and that was an eye-opener for us because, you know, we were following a similar model that insurance companies use with enrollment periods, and then we realized, you know, this doesn't work for us.
Oh.
We need to be available when people need us the most.
Right.
So, fortunately, we were able to open it wide up. So, enrolling in Prescription Advantage, we have
Let's
an
talk
app-
about it.
Yeah, I was going to say, because it's actually pretty easy. All right, first of all, there's a couple of different ways. You can call Prescription Advantage, and I'll give you the number because it is a toll-free number. It's 1-800 I'm sorry, that's why I have to look at this. 1-800-243-4636. Okay, again, 1-800-243-4636. You will get one of those prompts, you know, you want to press 2. If you press 2, that'll go right to Prescription Advantage. And tell them that you want to sign up. You can either have them send you an application form, or they will offer to do it right over the phone.
Excellent.
They will do that application. You could also talk to your Shine counselor. Okay, same phone number that I just gave you, the 1-800-243-4636. But if you want to reach Shine, you press 3. So it's easy. We also have a website. And for those who like to, be a little tech savvy, and we have an online application if you are comfortable with doing it yourself. And the website is www.prescriptionadvantagema.org. Okay, so that's Prescription Advantage MA is for Massachusetts.org. And you can enter the application there. Now, the only thing I do want to say about the application process, okay, filling out the paper application or doing it over the phone is part of the process because this is a program that does have income limits. We will ask for proof of income. So typically what we would ask for is a copy of the individual's most recently filed federal income tax form. And we only need the first page of
First
the
page,
1040.
right? Yeah. Mhm.
Yeah.
What if they don't find
And right now, we're in the middle of tax season, so everybody should
That's
have
a
that.
fetch.
That's handy. And if Social Security is part of your income, then we would also ask for a copy of either the 1040 it's a 1099.
1099,
that you
SSA
get from
1099.
Social Security.
I know the exact number because I was just doing my taxes last night.
How'd you
Yeah.
do?
So either the 1099 from Social Security, or we would accept a copy of the annual award letter. Okay, the letter
That's
that
great.
you receive in December that tells you what your benefits are going to
Easy.
be for the following year. So at the most, 2 pieces of paper. And if you're somebody who no longer files federal income tax forms, but you have a 1099 from Social Security, then
Or you have other income,
Yeah,
any
or you might- right,
W-2s
any
or something
1099,
like
yeah.
that. Any
So-
1099, a W-2 if you're working, just to verify that income. And-
Exactly.
And that's it. That's all. A copy of the Medicare card.
right.
Now, what if you don't have
Yeah.
Medicare? Are you still eligible?
You know, we will also work with other insurances. That's a very good point. And people who have It's possibly that they may have an insurance from a former employer. Now, they're not going to have a donut hole. They don't need to worry about the donut hole.
Right.
But we would work the same way with them. We would know at what point did your drug costs reach $3,700. And then after that point, we would help to lower copays. So
They
it's
can make
something
out
we
an
can-
application as well for.
Exactly.
That's wonderful.
Exactly. You know, people who, they may not have Medicare, but they may have very high copays with their insurance. They could get to a point with Prescription Advantage that we're able to help lower those copayments.
Great, that's absolutely wonderful.
Yeah.
And again, if you do have any questions about Prescription Advantage, certainly check out the website.
Yeah.
Okay, and you can answer some questions there. Certainly call a Shine counselor or call PA. Also, I'm going to give myself a little commercial. Shine, ShineMA.org. We do talk about prescription. That's our website here in Central Mass. We have a lot of good information there. We do talk about Prescription Advantage. Additionally, we have a resource page that has a link to that Prescription Advantage application as well.
Perfect.
So, I mean, we spent a lot of time in PA today, but this is a critical program.
It is.
Especially now. We're not concerned a little bit because we don't see the penetration numbers in a lot of communities that we would expect. People, unfortunately, aren't taking advantage of this program. We need to increase those numbers, not for any other reason, but for the simple fact that you need this valuable program. If
That's
it doesn't
right.
cost anything, it's probably 20 minutes to a half hour, no longer than that, in making out an application. It's not a onerous 10-page application. I think it's 4 pages to make out,
Yep.
and you know, you can get by it. And if you have any problems, you have help at hand.
That's right.
Just call
That's
that
right.
1-800-AGE-INFO number, and option 3 will be a Shine counselor. Option 2
Or
will
even
be
go
PA.
to your town.
Yeah.
You know,
if you're familiar with your senior center or Council on Aging, there's probably a Shine counselor. at
Shine
town.
counselor there, or an
That's
outreach
right.
worker
Nearby,
can
yeah.
help you. So.
Yeah.
Yeah, there's a lot of resources available to help with this.
That's right.
So, and we know there's people who will certainly benefit from this.
This has been a great program. Cindy, I'm going to get you on next month because I
Great, I'll be
think
back.
it's important that we chat
Yeah.
about Shine overall. But Kathy, thank you for coming.
Oh,
Cindy,
thank you for
helping
having
us
me.
out.
Thank you,
And, folks, thank you for watching. And we'll want to see you next month. We'll have another show. And we're very happy to be back with our new series of programs. Thank you.